As people grow increasingly squirrely, as Premier Ford recently put it, pressure mounts to understand where we're at in this pandemic. With us for a look at when distancing might begin to be wound down, here's Dr. Isaac Bogoch. He's an infectious diseases physician at the University Health Network and a scientist based out of the University of Toronto. Dr. Bogoch, how are you managing these days?
Not bad. I mean, sort of a little busy on several different fronts, but all keeping well otherwise.
I bet you're more than a little bit busy. Anyway, what do you think has to happen in order to begin relaxing the province-wide shutdown we've been experiencing for nearly a month now?
I think there's several things that need to happen before they even start to consider that. The first is not only do we need to see a leveling off of the number of new cases per day, but we actually need to see a decline, and we need to see a sustained reduction in the number of new cases per day before they'll even start to consider this. The second thing they need is, the capacity to really rapidly identify positive cases and ensure that positive cases and the close contacts of those positive cases are placed in a 14-day period of isolation. Easier said than done. That takes a lot of resources to do, and to really identify these cases and the close contacts. And it certainly takes resources to ensure that people are successful in their 14 days of isolation. So those are probably the two biggest things that I think are needed before they'd even start to consider lifting some of these public health measures that we're living under.
We've been told by both public health and political leaders that this week upcoming is sort of the key week, the critical week in terms of counting COVID-19 cases. Why would that be?
Well, I mean, we really are at an impasse here. And, it does look like there is some flattening off of the curve in Ontario, but we're still seeing anywhere between 400 and 500 new cases per day. And while there are, early signs of flattening, that's a lot of new cases per day. And remember that just because there's a flattening of the curve, it doesn't mean that hospitals aren't seeing a growing number of cases, and there still are finite resources in terms of hospital beds, in terms of intensive care unit beds, and even outpatient capacity to see these individuals. So if we don't start to see a slowing and a lowering of the number of new cases per day, we might be in a position where our hospitals will gradually fill up and where capacity might be met. And we see what happens in healthcare systems where they meet or exceed capacity, and it's not pretty. I mean, we don't have to look so far as to New York City. It doesn't look like we're going to be in a situation like that, but having said that, we don't want to come close to meeting the capacity that we have in our healthcare system.
Have we hit peak yet, in your view?
Oof, it's hard to know. I wish I had a good answer for that. Certainly it does appear at the Canadian level and even at the provincial level here in Ontario that there are signs of flattening, but really you don't know if you've hit peak until you're on the other side. I honestly don't think we're on the other side. So hopefully if we haven't hit peak, we're at peak very, very soon. But I think we also have to remember that, let's say we are at peak. Let's say we are at the early phases of being on the other side of the peak. I mean, sadly, that's where the hard part begins, because we really need to keep our foot on the gas pedal here. We really need to maintain the physical distancing, the hand hygiene, all the public health measures that got us to this place to get us way down the other side of the curve. Because then and only then will the senior health leadership think about lifting these restrictions that we're living under.
Well, surely everybody's got the message at this point about what we need to do. As you point out, the physical distancing, the hand washing, and so on. So among which groups of people, which demographics, in other words, in our society right now, are the new cases happening?
Unfortunately, we're seeing a significant number of cases in long-term care facilities. And day by day, we hear some tragic stories about new outbreaks in these care facilities, a growing number of deaths in these long-term care facilities. And in fact, depending on which province you're in or even which country you're in, the deaths in the long-term care facilities represent anywhere from 40 to 50% of the total numbers of deaths. So certainly that is a population that is significantly impacted, greater than most other populations. But of course, we know it's not restricted to that group of people. We know that people who are over the age of 60 and especially over the age of 70 and 80 are more likely to have more severe illness. So, by no means does that mean people who are younger are immune to this virus. We know any age can get infected, and sadly, we know poor outcomes can happen at any age. I think that's important to keep in mind. But when we take a step back and look at the 30,000-foot view, it truly is a population over the age of 60 and a population who have underlying medical problems that are disproportionately affected by this virus.
We have a pollster named Erin Kelly from Advanced Symbolics who's on this program from time to time, and she uses artificial intelligence, not just traditional polling methods, in order to get her information. And her tracking this past Easter weekend indicated that there was a 5% uptick in travel across the population during the course of the weekend. And I guess lots of people are going to be asking this question. Was it okay to get together with family and friends just for that weekend in order to celebrate Easter?
So a few points on that. The short answer is no, it's not okay. We know that we're supposed to be physically distancing from one another. Another way to put it is if you don't live under that roof, don't go into that house. And we also hear about this, staying 2 meters away. It's extremely important to do that. Now, let's think about that number a little more closely here. A 5% uptick in travel. Obviously, that's disappointing. We don't want to see any uptick in travel. But what would the number be had we not been living under these circumstances? I'm going to speculate here. I'm basing this on absolutely nothing, but I would wager that it is way, way, way higher than 5%.
Yeah, for sure.
Especially that it's Easter, it's Passover. I mean, that number would be astronomically high. So 5% isn't good. We want to see 0%, but I think 5% is probably a dramatic reduction on what it would usually be.
Sure, but is that also to conclude that we should anticipate a bit of an uptick in the number of cases going forward, even with as little as 5% of the population violating the protocols we're supposed to follow?
Yeah, certainly there may be. I mean, when it's as simple as this: when people mix together and when people congregate together in larger groups, the virus can be more easily transmitted. So, we might see a small uptick. I think it's going to be very challenging to make that. Is there going to be a smoking gun? I don't know, because this is also simultaneous with the province scaling up their diagnostic testing as well. So, whenever we're looking at the models of COVID-19 cases, it's sometimes hard to put into the appropriate context when we're sort of balancing other factors. But like human mobility and mixing of people, absolutely, that's an important thing to consider. It's also important to consider that we're, in the last few days and currently the provincial government is really doing its best to scale up diagnostic testing. So, I mean, a few days ago, we were having 2,600 and 3,000 tests done. Then it turned to about 5,000 and 6,000. I think the goal for around today or tomorrow is about 8,000 cases. Ultimately, they want to get to 13,000 diagnostic tests per day. So that has to be factored in as well.
Let me ask you about this. People are starting to, if you listen to talk radio and if you just, you do your Zoom calls and so on with people, people are, as the Premier indicated the other day, getting a bit squirrely now. And they're starting to talk about at what point can we start to either reopen the economy or practice a little bit less physical distancing. When that time comes, and admittedly no one knows when it is, how does it work? Is it basically, everybody's allowed to go back to normal all at once across the province regardless of where you live, or what?
No, I mean, I think it's interesting because there's this predictable second wave. And, when we start to mingle again together, we've heard about this term, the second wave, after, our curve goes up, then it goes down, and we flatten the curve, it goes down. Hopefully we can maintain it down. And then once we start mingling together, it might start to go up a little bit. The key here is we know it's going to go up a little bit. Whenever people are going to congregate, it's expected that it's going to go up a bit. But can we control how high that rises? And it's really interesting because right this moment, if we look at countries that have already experienced their first wave and are now slowly opening up, we're talking about Hubei province in China, we're talking about South Korea, Japan, Singapore, Hong Kong. All of these countries and regions right now are experiencing a second wave, and it'll be very interesting to see how these regions and countries manage that second wave. And I think the key thing here is you can't just open up willy-nilly. You can't just say, okay, we're back to normal. Let's all go back to work and let's all go back to school. This will obviously be done in a very careful and controlled manner. And I don't think we're going to go back to life that we remember until we actually have a vaccine. And I think we'll start to see a gradual loosening of restrictions. But again, as we sort of chatted about a few moments ago, in order to do that, we really need to have the rapid ability to identify cases and the close contacts of those cases and ensure that those people are placed in a 14-day period of isolation so that they don't really get us back to square one and we have a big rise in the number of cases. So a lot we can learn from countries that are currently experiencing this. And still, I think, as you point out, a ways to go before we even start to consider it as well.
There's a journalist in the States by the name of Ed Yong, and he wrote a very substantial piece in the Atlantic magazine just about a week or so, or I guess it's a few weeks ago now. And I wanted to read just a small excerpt from that piece and then get you to comment on it. It goes like this. It's likely then that the new coronavirus will be a lingering part of American life for at least a year, if not much longer. If the current round of social distancing measures works, the pandemic may ebb enough for things to return to a semblance of normalcy. Offices could fill and bars could bustle. Schools could reopen and friends could reunite. But as the status quo returns, so too will the virus. Your view on what he just had to say?
Yeah, I think he's spot on. I think that's completely aligned with science and public health, and it's great. I mean, it's a great viewpoint because I think it's accurate. And look, we're watching this unfold right now in many of the Asian countries that are currently lifting their public health restrictions. So, I'm fully supportive of that, and that's really why we have to be very careful when these restrictions are lifted so that we can really mitigate how high that expected second wave becomes. And I'm not going to say there's any easy answers. I don't think anyone has a simple solution to this. This is going to be very context specific because how we mingle and how we go about our day in Ontario and in Canada may be different than how people go about their days in other parts of the world. So I think we're going to also see some very locally applied solutions to how this unfolds. But I still think that his point is clear that if we mingle together in the pre-vaccine era, and most of us aren't immune to this virus, yeah, we can expect to see a rapid growth in the number of cases.
And to the best of your knowledge, the time estimate the Prime Minister has given of 12 to 18 months before a vaccine is seen, you think that's accurate?
I don't have a clue. I mean, I know I'm guilty of this as well. I keep saying 12 to 18 months too, and I'm following this as close as anyone. What gives me hope is that there are, I think about 50 or 70 different teams working on vaccines. They're working on several different approaches to the vaccine, so they're not all taking the same approach. I think there's a handful of groups that are now entering human trials, which is obviously very promising and great to see that there is progress and some steps in the right direction. But, of course, we know that vaccine development, it does take time. I think 12 to 18 months is probably the earliest that we're going to see this. I'm obviously very hopeful. I want this just like everyone else is sooner rather than later. But we also have to be realistic that it's a lot of work to get a vaccine. Fortunately, there truly are an infinite number of resources being poured into this because most people on the globe appreciate that is the durable way out of this pandemic.
Mm-hmm. Now, as it happens, the timeliness of our conversation couldn't be better right now because it was just late yesterday that the World Health Organization said before, and I'll use your expression here, before we take our foot off the accelerator, 6 conditions ought to be met first. And let me just take 30 seconds to say what their conditions are and then get your reaction to that. Number 1, transmission is controlled. Number 2, health system capacity is in place to detect, test, isolate, and treat every case. Number 3, outbreak risks are minimized in specific settings like nursing homes. Number 4, preventive measures are in place in workplaces, schools, essential businesses. Number 5, managing the risk of people bringing the virus in from other countries. And number 6, communities are fully educated, engaged, and empowered to adjust to the new normal. I guess a two-part question. Number one, do you like that list? And number two, how close are we to that?
So, that list is great. It's almost like they've done this before. It's almost like they have the world leaders and experts thinking of this. I mean, it's great. I mean, that's a very well thought out list. It's terrific. I mean, it's comprehensive. I think the word is it's completely comprehensive. And if those 6 points are truly adhered to, I think that will provide a region or a country with success in managing their population and the extent of damage that's done from this virus in the pre-vaccine era. I wouldn't add or change anything. I mean, it's a very well thought out list. I think it's also very timely today, and I'm not trying to get political, but it's also very timely to discuss this because we heard recently that our neighbor to the south has temporarily cut off funding to the World Health Organization,
500
which
million
is,
bucks.
yeah, I mean, I think that's, was it? They said it's about 15% of the budget, which is essential in the pandemic, the global pandemic response. But I would even add to that, even beyond the pandemic, there are so many critical global programs, especially in low income countries and low middle income countries, that really rely on these funds. So this is really, sadly, this is a tragic situation, and this will have a tremendous negative impact that will be disproportionately felt in low-income countries and low-middle-income countries. So I hope they can resolve this impasse very quickly to help with the current COVID-19 response, but also to help with other health-related issues that the rest of the world is facing.
Hadn't planned to go here with you, but since you raised it, you're quite right. Donald Trump said yesterday that he wanted to put a freeze on the funding that America provides to the World Health Organization, and he did so, he said, because he thought that they dropped the ball at the beginning of this thing and didn't give countries around the world the best and, as it turns out, the most accurate and effective advice. What's your view of that criticism?
Listen, I think everyone should be held accountable. If you're a public health body, if you're a public health official, if you're an elected official, you've got to be held accountable. And I'm not going to say that the WHO knocked it out of the park every step of the way. They didn't. And you know what? Neither did anybody else. Having said that, we still can hold our public health bodies, our senior health leadership, our elected leadership accountable. We can do that while simultaneously supporting the essential measures that are in place for a coordinated global response. So, I mean, I'm all for holding people accountable. That's great. And we can have those conversations. They might even be helpful to start now. I personally think it's, let's take care of the urgent situation first and then have those conversations. But like, we should not be detracting anything from a coordinated global response to this pandemic. And, that money is going to be sorely needed to help the coordinated global response, and in addition to other health-related issues around the world. And I just think it's, I'm mostly here for science and medicine. I rarely get political, but this is just a bad move on all fronts.
Understood. Okay, back on the path here. You know, of course, that Wuhan, which was the epicenter of this pandemic in the first place, have lifted their shutdown of basically their economy and so on. And I wonder if you could tell us, because obviously we're looking forward several weeks and or months to see how we will be able to reopen the economy at some point. What are they still not able to do in Wuhan post-pandemic that they could pre-pandemic?
Oh, it's interesting because I think this is a moving target. So we're starting to see people go back to work. I'm not entirely sure if all sectors are back to work. I know it's not life as per their norm, but I think it's closer to that than what people might have expected. I'm not entirely sure about schools as well, but I think what they are very concerned about is the introduction of new cases from outside of China. And in fact, Wuhan, Hubei province, and China in particular has been quite vocal about the number of new cases that they're receiving, but especially those that they are importing. And their concern is, are those imported cases going to contribute to another epidemic? So while life does return to normal in Wuhan and Hubei province and elsewhere in China, they're now taking measures to really mitigate the negative impact that imported cases can have. And I think they're really doing their best to come up with a national strategy to ensure that people are screened when they come in. People may be placed in a 14-day quarantine period or isolation period, and they're really ramping up their diagnostic testing on the ground to make sure that those individuals who are positive are isolated quickly and don't contribute to a big second wave.
Hmm. Again, I don't mean this question to sound as political as it might sound, but I'm wondering whether we ought to be taking our cues from those officials in Wuhan in particular and China in general, given how they tried to at first falsify and then deny and then, well, we don't have to go through chapter and verse of their history with this here, but it was not covered in glory, as you'd put it. So should we be taking our cues from them?
I think we can certainly take positive lessons from lots of different places, including China. And of course, there's also negative lessons that we would steer very clear of. Obviously, we're in an era where we need radical transparency, and we need, I would say, immediate access to pertinent information. And of course, there's stories about how those those types of ideologies were not upheld. We can also, but in all fairness, it's hard to put a blanket statement over an entire country. And there were certain scientists and particular officials that were sounding alarm bells early on. Sometimes those voices weren't heard, but in general, I think in the era of this pandemic, radical transparency and the rapid sharing of information is vital. We can also learn some lessons, though, mainly from some of the neighboring countries. So South Korea has been a leader in this front. Taiwan, believe it or not, has been had a remarkable response to this outbreak and has really limited the damage that's been done, at least at a human human health side of things. Singapore and Hong Kong have also done a pretty good job as well. So I think we can learn lessons from them and maybe cherry pick some of the lessons that we learned from China and not just take them as a whole package.
Speaking of neighboring countries, would you recommend continuing to keep the border between Canada and the United States effectively closed to non-essential travel for the foreseeable future?
Yeah, I mean, this is going to be a moving target. This is clearly going to be a moving target. And we know that the burden of illness in some parts of the United States is way bigger than the burden of illness that we have in Canada. We have places like New York and New Orleans as well, I think was having a pretty bad outbreak. But we have to be very careful about when we sort of open up our border to the United States. And I would even broaden that to globally, because obviously we don't want to import new cases and start new outbreaks. So, when that border reopens and when travel starts to slowly pick up, I think we're going to still see some public health policies in place that will certainly mitigate the impact that imported cases may have in Canada. So I don't think, for example, we'll see an end to this 14-day period of home isolation anytime soon. So if the border does open up, I still think we're going to see these 14 days of home isolation. And in fact, we heard about a day or two ago that you'll need to show evidence of a plan, like an actual plan in place of a it's not good enough to say, yeah, I'm going to go home and I'm going to hang out for 14 days. You actually have to have evidence of a good plan that will enable you to successfully isolate for a 14-day period of time. I think that's a good idea. But full disclosure, border closing and restricting travel is part of the puzzle. Obviously, we know that we're balancing this with significant economic hardships, and how do we balance that with the introduction of the virus and public health safety? I mean, this is certainly a challenging path to walk, and you're sort of walking on a bit of a tightrope here.
Mm-hmm. Isaac, we've got about 30 seconds left here, which is enough time for me to ask you one last question, and that is this. We did have, after SARS 17 years ago, a post-SARS task force / Royal Commission, a real good investigation to find out what went wrong and how we can improve on it next time. Should we do the same thing after COVID-19 is all said and done?
So yes, we should. And the first thing that they should do is read the report of the SARS post-SARS task force report, because I think they will see that they don't need to recreate the wheel or reinvent the wheel, that much of what they're going to say has already been thought of and has already been written. And, it might have been nice if people had read that post-SARS report and acted on all of the action items there, because we may be in a different position now had they have done so.
Stay safe, and thanks so much for your time.
Be well. Have a good one.
Thank you. Dr. Isaac Bogoch from the University of Toronto and the University Health Network.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.